Dr. Esteban Ramirez from the Protect Purdue Health Center, Dr. James Bean from the IU Arnett Hospital, and Dr. Dan Wickert from the Franciscan Hospital. Let's take a look at our local data. We've been tracking 5 data points with regard to our COVID-19 pandemic here locally. The first is the number of new confirmed cases of COVID-19 in Tippecanoe County. The second is the percentage of COVID-19 tests that are positive. This is also known as a percent positivity. Third is the number of COVID-19 hospitalizations, including the number of patients in intensive care and on ventilators. Fourth, the number of emergency department visits for respiratory illnesses. And lastly, the number of deaths due to COVID-19. This slide summarizes our current cumulative case data. Cumulatively, we have almost 20,500 confirmed cases of COVID-19 here in Tippecanoe County. Of those, 18,383 are considered recovered. We've had 210 deaths, that is 4 more than last week, leaving us with 1,900 active cases of COVID-19. In the last 7 days, we've had 133 new cases, and in the last 28 days, just over 1,000 new cases of COVID-19. This next slide shows our daily new cases of COVID-19 dating all the way back to nearly exactly 1 year ago when we had our first case of COVID-19 here in Tippecanoe County. As you can see, we had a very significant surge of cases during November and December and the early part of January. Fortunately, our numbers have significantly decreased since then, and we are hoping that this trend, of course, will continue. This slide shows the same data, but in a different format. This is the average daily number of cases, new cases, by week. As you can see, the shape of the curve is very similar, with a very steep incline in November and with some very high numbers in November and December, and then trailing off heading into January, and currently down at 29.9 average cases per day, average new cases per day. Nearly 109,000 individuals in Tippecanoe County have been tested for COVID-19, 1,700 of them in the last 7 days. Our percent positivity is currently 2.6%. This is lower than the state of Indiana at 3.1% and lower than the country as a whole, which is sitting at 4.1%. This slide shows the trend in our percent positivity by week, dating all the way back to July. And you can see we had some very high percent positivities in November, December, and early January. Fortunately, our percent positivity has decreased significantly to its current level of 2.6%. This slide shows our combined hospital data for COVID-19. This is data from both of our local hospitals combined. The top line are the number of patients in the hospital with COVID-19. Again, very high numbers in November and December, and then decreasing numbers heading through January and February and into March. The top line there again is the number of patients with COVID-19 in the hospital, in our hospitals, 13. The second line is the number of patients in intensive care units, and the bottom line is the number of patients on ventilators with COVID-19. So a very favorable trend in our hospitalization data. This slide shows our emergency department visits for respiratory illnesses, again by week. As you can see, the number was quite high during November and December and has decreased as our other data has. Last week it was 127. I apologize, that number doesn't show up very clearly there, but the last 3 numbers are 129, 128, 127. So again, much lower than they had been in the last several months. And this slide shows our number of deaths due to COVID-19 here in the county. And you can see that we had a very significant increase in the rate of deaths through November and December and heading into January. That rate of increase has slowed and is, as you can see, the curve is starting to flatten out, leading to our current level of 210 deaths due to COVID-19. This slide shows cumulative combined data for our K through 12 schools and school systems in Tippecanoe County. As of March 9th, we've had a total of 1,734 cumulative confirmed cases in our schools. That'd be 64 in the last 2 weeks. You can see the breakdown there between students, teachers, staff, and administrators, bus driver, and student teacher. Below that, you'll see the number of cumulative close contacts that have been quarantined, 10,693, 267 of those occurring in the last 14 days. Of those students and staff members who've been quarantined, 256 of them ended up testing positive during their quarantine. And I wanted to finish up with some information about COVID-19 vaccinations here in Tippecanoe County. As of today, we've had just over 30,000 Tippecanoe County residents receive their first dose of vaccine. 18,830 have received their second dose of either Pfizer or Moderna vaccine, or they have received one dose of the Johnson & Johnson vaccine, making them fully vaccinated. So that's about 9.6% of our county's population is considered to be fully vaccinated. Groups that are currently being vaccinated include healthcare workers and public safety personnel, long-term care facility residents and staff, people ages 45 and older, people with certain high-risk conditions. The full list of high-risk conditions can be found on the Indiana Department of Health COVID-19 website, and K through 12 teachers and school staff. The Indiana Department of Health will be expanding criteria further in the near future, so we'll be watching for those new criteria. Our county health department runs a vaccine clinic at 2577 Maple Point Drive in Lafayette. The hours are shown on the slide. We are vaccinating people by appointment only. If you are eligible, you can register online at ourshot.in.gov or by calling 211. Currently, our clinic is providing the Moderna vaccine. That's a 2-dose vaccine the doses are given 28 to 42 days apart. We also have begun receiving small supplies of the Johnson & Johnson vaccine. That is a single-dose vaccine, and we are currently administering that to individuals who reside in homeless shelters. Soon we'll be expanding that to homebound individuals, community corrections, and the county jail, and then to others as our vaccine supply increases. Our local COVID-19 data is moving in the right direction. The number of new cases, percent positivity, hospitalizations, and emergency department visits have decreased. The rate at which deaths from COVID-19 are occurring is also slowing. We are hopeful that these trends will continue, but we need to remain cautious, especially with the spread of variant coronavirus strains. The UK variant is predicted to soon be the dominant strain in the US and could cause another surge of infections. Today, Tippecanoe County turned blue on the Indiana Department of Health COVID-19 dashboard, but we remain under a yellow advisory status per the State Department of Health and the governor's executive order. When our advisory status drops to blue, the order limiting social gatherings to 100 people will be rescinded to match Governor Holcomb's social gathering limitations for counties designated as blue. Tomorrow, the NCAA men's basketball tournament begins, with 6 games being played at Mackey Arena. While this is an exciting time for our community, it is important that we celebrate carefully. Remember that COVID-19 spreads easily in crowded indoor spaces. Please keep watch parties small. If you are gathering with people from outside of your household, we recommend social distancing and face coverings. With the arrival of spring break, please keep in mind that according to CDC, travel increases your chances of spreading and getting COVID-19. The CDC recommends delaying travel. If you decide to travel, please visit the CDC website for recommendations about testing before and after you travel and quarantine after travel. Remember to wear a mask, maintain social distancing, and avoid crowds. To prevent disease and save lives, we need to continue preventive measures. even though we may be tired of these measures. Continue wearing face coverings, social distancing, washing your hands, avoiding crowds, staying home when sick. Get vaccinated when it's your turn. The COVID-19 vaccines are safe and effective and are critical in the fight against COVID-19. Remember that your actions really do matter. Let's keep our community moving in the right direction. Thank you. I'll now take questions from the media and from our social media audience. Thank you.
Emily DeLetter with the Journal and Courier. Since the county is designated as blue, but we're still under the yellow advisory, what exactly does that mean? When is the soonest that it can be lifted and turn completely blue? And what exactly are those restrictions for gatherings, things like that?
Sure. So the way the governor's executive order is set up, once we are blue for 2 consecutive weeks, then our advisory status would drop to blue. And at that level, then social gatherings would be permitted up to 250 people. Greater than 250 people requires a submitted plan to the health department and then approval from the health department.
And a couple questions for Dr. Ramirez. One, if you can give any updates on the Purdue vaccine clinic, and also has any of the Purdue testing labs found more evidence of the UK or other variants here in the county?
Absolutely. No further updates on the vaccination supply. We're still ready. We still have everything set up. We just need, we know that within 3 hours we think we can make it active. So we're hoping we'll get the news soon. With regards to B117 variants, we have 11 total now that we've identified. And again, mildly symptomatic. Half of them were asymptomatic and the rest were mildly symptomatic. Nothing that we've seen that would be higher in severity at this point, which is good news, and they were able to complete isolation.
And the 2.6% positivity rate reported today, I noticed that was the lowest since, I think, September is what I wrote down. Is that a good sign for the county as well?
Yeah, absolutely. That's a great sign. That is the lowest percent positivity, as you pointed out, since mid-September. And so our data overall is back down to where we were in about mid-September. And we'd like to see that data, of course, continue to move in a downward direction back towards the numbers that we were getting last summer.
So obviously last week we heard the president say that by May every adult will be eligible to sign up for a vaccine. What does that mean for rollout here in Tippecanoe County?
You know, one, we were very happy to hear the president say that, and in terms of rollout here in the county, we are ready to vaccinate as many people as we get vaccine for. That's the one component that determines how many people we can vaccinate is the allotment of vaccine. We have the capacity and the capability to vaccinate more people than we are currently. So once the vaccine supply increases, and it sounds like, according to the president, it's going to, we look forward to being able to vaccinate more people every day.
Yeah, that was going to be my follow-up, because my understanding has been that in the past, the limit here has been supply of the vaccine. Do we have a sense for what our kind of peak capacity for vaccinations might look like?
Kayla, do you have an idea what that number might be?
Yeah, currently with our staff and the volunteers that we have right now, it would be about 300 a day. We could look into increasing that if we did see a big supply, going to a drive-through clinic. We are starting working on the plans for that. But right now with the actual in-space clinic, 300 a day.
Yeah, and so that means, yeah, I guess, if I can sign up starting May 1st, how long out are we thinking, a vaccination for someone like me might look?
Mm-hmm. So at the county health department vaccine site, the appointments right now are being booked into like mid-April. So there is a bit of a wait. Again, as the vaccine supply increases, more appointment slots will become available, and we hope that the wait time will go down. There are other vaccination sites.
Weeks from now, because we're not spending the time checking the schedule. We're kind of busy, so but hopefully, right? Yeah.
Of note, if I could mention something real quick, next week, March 24th at 7 p.m., the Black Cultural Center is going to have a vaccination hesitancy panel. I believe it was in the Journal and Courier that was announced, and so we're really excited to be able to kind of address some of those concerns.
And I had a question about the county vaccine site. I know you had previously mentioned thinking of turning the Happy Hollow, using as a testing site currently, into a vaccine site. Is there any progress on that? Is that still kind of the plan for now?
It's still in the early planning stages, and a lot of that will depend on vaccine supply and whether we need an additional vaccination site.
Sure. And I know that the Johnson & Johnson vaccine is being used to currently vaccinate people, the homeless population, through LTHC. When did that effort start, and how many were you able to vaccinate since that's begun?
Sure. I believe the first day was it last Friday, Kayla? Yeah. Kayla, if you want to make a comment about that.
Yeah, so last Friday we were there from 10 to 2 p.m. And we did around 40 people. It takes a lot longer than just administering the vaccine because they're not registered in the database at all, right? So we haven't collected any of their information into the Zotec system ahead of time. And so the school, there was a clinical Purdue student of nursing there, and they helped administer. In hindsight, we ran out of time and didn't even get everyone that was interested in getting the vaccine. So the staff is going back this Friday. I've added more staff to go to help with the registration process. And so we are going this Friday. We'll keep going as long as we have the J&J supply. We have a very limited supply of that vaccine right now. And until there's, we want everyone who's interested in that population to get a dose. We also are working with the domestic violence shelter and Family Promise to ensure that those people receive their vaccine, and then we will be reaching out to LUM. LUM's a little bit harder because they're there in the evening time to sleep. So if we can capture that same population at Lafayette Transitional Housing, that would be the goal. But if we need to go to LUM, we will go to LUM at 8. We'll work that out.
And for some of those groups who may not have like IDs, which I know are currently necessary to, prove that you're there to get a vaccine, how are you working around those barriers?
So we have experience working with this population, and so if they're registered with Lafayette Transitional Housing or LUM, we will use whatever they registered with that. We'll use a birth certificate. We'll use an old intake from the jail picture ID. And so you just have to get creative when you work with this population to reduce the barriers.
And as far as vaccine goes in general, have you noticed any slacking off in vaccine interest, or is it still, as strong or stronger than when you began?
My impression is that the vaccine interest is very strong, and that we wish we had more vaccine available because we could meet the demand sooner than we're able to.
I'll just add to complement the numbers that Dr. Adler referenced. So at IU Health Arnett, we continue our vaccine site. We're providing the Pfizer vaccine Monday through Friday now, and our daily capacity is right around 300. We're going to increase that a little bit in the near future, probably to 375.
This question is for, Dr. Ramirez. With spring break underway, what are you going to be doing to make sure that students coming back after traveling, staff coming back after traveling, are not going to spread the virus?
Yeah, so messaging is going out about being extra careful. Really, the expectation is folks don't go and travel long distances because that kind of breaks the bubble, right? That's why we tested individuals early on, is so that we kind of have this safety kind of bubble that's been developed. So we're doing a lot of messaging around, if you do travel internationally, these are the guidelines. You do need to quarantine. You do need to test day 3 to 5. If you are traveling to other states, monitor for signs and symptoms and report them immediately so that we can get you the appropriate care that you need. So just kind of reiterating what the current guidance is. We know we can't force anyone to do, whether to stay or go. So I think just knowing what are the expectations, depending on what the choices are or what the decisions that are made, what this should do next.
Are you guys doing any mandatory testing?
We're not doing a test all like we did coming back from the fall or spring. No, nothing like that. But we have a very aggressive surveillance testing plan, which will kick in immediately as soon as folks are already back.
Okay,
Yeah.
thank you.
Okay, so Facebook Live, question, what can you share about children getting vaccinated? If that is in the works, and when will we know more about it?
Yes. That is a great question, and I was very happy to learn just recently that studies are currently underway involving children for the COVID-19 vaccines. And interestingly, the studies are going down to the age of 6 months old. So the hope is that that study data is available by summertime, and that children under the age of 16 will be able to receive the vaccine by late summer. That's the hope. Currently, the Pfizer vaccine is approved for 16 and 17-year-olds. Moderna and J&J are 18 and above. But the hope is that sometime this summer, it will be possible to provide COVID-19 vaccinations to children.
Another Facebook question, what is being done to encourage the hesitant people to get vaccinated, especially since this seems to be a problem in the eligible age groups as they become younger?
Mm-hmm. Yeah, another great question, and I think certainly it comes down to messaging and getting accurate information out to people about the vaccines, making sure that people are getting their information from trusted, accurate sources, so they understand the benefits of the vaccine and really how important the vaccine is for all of us to take another step towards getting back to normal. I mean, that's what everybody wants, is to get back to normal, get back to the way things used to be. And the vaccines are such a critical part of that. So we're really pushing that messaging here locally, and as you know, it's being pushed across the nation by the federal government and other organizations.
And several mass vaccination sites recently opened around the state. In Tippecanoe County, there wasn't really one kind of in our area. Is there any conversation, as far as you're aware, to open one here? And do we have the capabilities or the capacity to host something like that?
Sure. We would love to have one here. Those are run by the Indiana Department of Health, and they have scheduled several around the state. We're hopeful that we get one here. Certainly, there are plenty of venues that could easily host something like that, and we would be happy to work with the State Department of Health in coordinating something like that.
As we're kind of coming back up towards Easter, back towards religious celebrations towards the end of the month, what are you thinking about with guidance for that? How could that kind of start evolving for the rest of the month?
Sure, sure. So I think the main message is going to be very similar to the message that we spoke about in regard to Thanksgiving and Christmas, and that is being very cautious about gatherings, even small gatherings that involve people from outside of your household, and being very careful about how those gatherings are arranged, looking at social distancing, face coverings. You know, with the new CDC guidance for people who've been fully vaccinated, those individuals can get together with other family members who have been fully vaccinated without social distancing and masks in a private setting. But with Easter just around the corner, there will likely be the majority of people not vaccinated by that point. And so I think the same guidance, the same recommendations that applied for other holidays like Thanksgiving and Christmas are going to also apply for Easter. We just need to be very cautious about this and aware of how easily the coronavirus spreads, even in small gatherings.
So I guess, and the numbers are so much better across the board. I guess what is the level of concern? Just right now, we've just got several things kind of popping up, coming together at the same time. We've got March Madness coming through town That's going to lead to gatherings. We've got
Yeah.
Easter coming up. We've got spring break happening across school systems. So just some things kind of simultaneously coming to the surface. Are you worried that that could, lead to a spike at some point in the coming weeks?
Yes, absolutely, because we know that those gatherings, even small gatherings, are risky for transmission of COVID-19. And travel, as the CDC points out, travel is a risk factor for spreading or getting COVID-19. So those things you listed in and of themselves are potentially factors that could lead to an increase in cases. And then the other factor that is somewhat unknown are the variant strains. We know we have the variant strains here in our county as they are being found throughout the country. What we don't know is to what extent are they here. And the strain that seems to be the predominant variant is the UK strain, which is more contagious than the original coronavirus strain. So that could also present problems for us and could potentially lead to another surge in infections.
Thank you.
Okay, if there are no further questions, I'd like to thank everybody for showing up and